If you are a nurse and you get anxious or nervous every time you start a shift, or you're about to start a shift, or you just feel scared, or if you're a nurse who's trying to re enter the clinical space, but you are nervous about it, this video is for you. Hi, my name is Daniel. I have been a nurse for like more than 10 years, and just like you, I am planning to re enter the hospital clinical phase because right now I'm working as a school nurse, but I am now slowly feeling the move to go back to hospital nursing. And what I'm going to share with you is how I cope with being nervous and scared before and maybe during the shift. And I also dedicate this in particular to a close friend of mine who I went to nursing school with in college. We took the board exam together, we became a registered nurses together, and she did work in a hospital, but then she got overwhelmed from anxiety and left. But then now she is reconsidering, and we're kind of on the same boat too, although I didn't leave the hospital per se from anxiety. And my journey is that there was a time though that I did that. My first job at a hospital was at a 500 bed capacity tertiary joint commission accredited hospital in my country. And my floor was medical surgical with a communicable disease wing. And I was always known to be the most confident person in college. I even thought I was confident. But it turns out that I was overwhelmed with emotions, I was scared. I think the inner perfectionist in me that nursing school trained us to be really took the best of me. Every day I was scared I might make a mistake. Every day I was worried that what if my actions or my failures would lead to someone's death, and that really took a toll. And I know for a fact that this is not a special like individualistic experience. I know that many nurses go through this, and this is me sharing my part to help you hopefully overcome that. Did I overcome it? Yes. But before that, I did quit. I did quit my first nursing job, my first hospital nursing job, after a week or two on the floor. After, of course, it's after training, and then after a week or two on the floor, I thought that I was not going to be a nurse anymore. I did some reflection and I realized, you know what? I do have to be a nurse. But I'm going to talk more about that in another video. For this video, I want to talk about how I became a little bit more brave, more confident in the floor. But of course, let's start with this. Everything everything takes time, all right? And just like in video games and just like in life, the more you try things out, the more you experience things, you build XP, experience points, and then you become better at it. Will there be a time wherein you wouldn't be afraid to go to work anymore? Yes, there will be a time where you are just full confident, no fear, and that's how I felt. Eventually, and that's how I knew it was time for me to move on from that space, from critical care. It's when I stopped being afraid, and I'm just like, it's all routine now. But will there be moments where you doubt yourself, where you feel anxious or minimal anxiety? Yes, it's normal. And the reason for that is that because you're human, and that's a good thing, that you still have your humanity. And I remember this TV show, this nursing TV show, I think it was Nurse Jackie, where she was asked, how do you know when it's time to leave nursing? Or how do you know when it's time to leave where you are in that area of nursing? And her answer was, the moment you don't feel afraid anymore. And I didn't really get that back then, but my interpretation of it now is more of like, when you're not afraid, you feel like a patient is not a human being anymore. They're just a bed number, and you just do what you can, and then you're done. Wipe your hands off, clean, and you're done. Although it's very important in being a nurse to be human, it's a good thing. It's very beneficial to the patient and to your experience, but at the same time, it could lead to your detriment because human as we are, we're always going to be we're built in to be compassionate. And I hate to say this, but we're also in nursing school, we're very trained to be people pleasers. And there's really no problem with that. The only issue is just the systems in place that are not conducive for us to please everybody. And I guess this is going to segue to my first topic, our first strategy on being a little bit confident or braver on the floor. And also this is one thing, if there's one thing that you should take away from this video, it's this. You as a nurse, or if you're not a registered nurse, if you're someone who delivers nursing care in whatever shape, form, or size, remember this, that your job, your number one priority, no matter what setting you are, inpatient, outpatient, company nurse, your number one priority is safety, patient safety. And you might wonder, versus what? In contrast to what? Patient safety triumphs over patient satisfaction, okay? Patient satisfaction is customer service. It's making sure everything is on time and at the patient's whim. Everything happens. But this is not the case if you are not one-to-one nursing. And this is, I think, what many patients don't realize is that the patient is not the only patient for the nurse. The nurse is looking after 6, 7, 10 patients. In California, good for them that they have these laws that I hear wherein they're very strict with patient-nurse ratio. In many states, there is no solid law about that, okay? And that's where the challenge is. That's where your energy is drained, because at all times your mind is thinking about the welfare of these, let's say, 10 patients that is under your care, okay? And this is one of the reasons why nurses are anxious, are nervous, are overwhelmed to come to work, because they already know, like, oh my god, like, I'm gonna have to look after these 10 human beings. And here's the thing, you're not only catering to these patients, you're also catering to their family members, and you're also catering to the medical providers, the other medical team, and your coworkers. So there's really a lot of moving parts, a lot of people involved in your care, leading to really a drain in your energy. Now I digress. So, patient safety first. And how does that look like too? Upholding patient safety means you're gonna have to, look at your patients and triage which one has the highest acuity, which one under your care needs more attention. And unfortunately that's just how it is. Okay? So if you have someone who is more critical-ish on the floor versus someone who's come in for a checkup or a routine, how do you say, it's ultrasound or endoscopy, no active conditions, then you know who to make sure you give their medications first. And I remember at the nursing home, they always tell us to prioritize giving antibiotics, which is true. It's antibiotics and insulin. You should always prioritize giving these medications. And I know that we want to work orderly, in an organized manner, because it's less stressful for us. Meaning, if we're assigned to rooms 1 to 10, we want to give the medications from starting at room 1 first, going down to room 10, not 8, 4, 3, 7, based on our triage list or our priority list. But it's up to you. If you can manage that, good for you. And if not, then just do your best and be as quick but as safe as you can, okay? Now, I don't want this video to be too long. I want this to be at least like 10 minutes or 11 minutes or so, or under 15 minutes. And I think that was the introductory video that I just shared. But before we leave this first episode, safety first. Number Two is having to be less stressed, is to have a sense of control. I know that it's impossible in this world to have control over everything, but at least 40% you do have control over. And one of the ways I do it is having what we call a flow sheet. Get a piece of paper, make folds, and just for example purposes, let's say I am assigned to 7 patients. So I have these 7 boxes here, and at the top of the right corner, I have date is September 13, 2025, and the date today is Saturday. And then I also placed in these hours from 7 o'clock to 6 p.m., pretending that it is a 12-hour shift. And I put these markers to the letter M is for is when I do medication rounds. I at 10 o'clock here, and then if you can see it, but at 10 o'clock over here I placed OR just to pretend that I have a patient under my care who is going to be picked up by the theater or operating room at 10 o'clock. So I better make sure that before 10 o'clock I have my papers ready. And then at 1 o'clock here I wrote CT. So for example, I have one of my patients is due for a CT scan, and make sure that I have the papers and the preparations ready. I also usually also put, of course, the room number beside these letter codes. These are the room numbers, and I write their names. It's literally as I receive endorsement or report or handover, I write their room number, their names, what they're in for, and then I write their IV. I try to make my own codes and abbreviations. So that's my sign for an IV. It's like a connected letter I and V, D5LR at 100 mils per hour. And I also write down the number of the bag of the IV. This is my code for diet. Some patients have, it's always endorsed like what their diet is: regular diet, diabetic diet, or a soft diet, liquid diet, or NPO, no eating, because they have a procedure coming up. Now I know that I remember that one of the things that I get overwhelmed with when I was working as a nurse during handover, endorsement, or report is these diagnoses and these long stories of why the patient came in. It's okay if you don't know the whole story of all of your patients under your care, because there are too many to know. What's important is you have a copy of, usually facilities will give you a copy of their condition, so that if you forget at one glance, you can see who they are and what they're in for. But if you don't, and even if you did, it's nice to make notes and to just underline things and to keep things simple. And here's a pro tip for myself, is that even if you don't know the conditions of the patients, when you look at their medication list, you will have an idea of what they're living with, what conditions they're living with. Okay, so the medication list. Another pro tip is looking at their medication list tells you already a lot about their condition. So that's a good reminder and review for you. All right. So having a flow sheet. So for having a flow sheet gives you this sense of control. You get to have a bird's eye view of what to expect, what medications are due. Back in the day when I was working in the Philippines, I would write down what medications are due for each patient. When you do work with electronic records, it does make everything easier. So for example, in the Philippines, I used to write everything down on paper in my flow sheet, like every medication due in my shift. I would write it down in each box. But then when I moved to London and worked at their hospital with the electronic system, I don't write down their medications on paper. Yes, I still keep a piece of paper, but what I do write are the times that they have medications due. Okay? Now I understand that I said that I was going to write letter M on these hours to indicate what time I would do my med pass, but there are some medications that don't follow the regular times, and also the key thing to memory is repetition. So the more I repeat, like marking down at what hour I do medication pass, and I write down medication times due on each of their boxes, repetition is key to memory and to making sure that you're gonna do it. And it also helps you to be less anxious when you know that you're pretty sure that this is should be given at the exact time, especially based on your flow sheet. Now, there, the first hospital I worked in, they did try to ban, not just discourage, they tried to ban us from not using a flow sheet because it would lead to errors, etc. And I'm just like, in my opinion, this would minimize errors because this would remind me of what time I should be giving medications. Because if I rely on the book, that we use a book at this hospital, no electronic records yet. We use a book to give medications. There might be a leaf that's missing, or I might or one leaf might stick to the other leaf, and then I wouldn't see it, and then I would miss giving medications from that entire page, which has happened. So I like it's always about double checking and double checking, double checking, and having that system to be safe. So just a recap, flow sheet is very important. And if you work in a facility where, although you'll be assigned 7 patients, but you're required to listen to general endorsement for all the patients on the floor, then what I do is I would have blank space at the back and literally write down everything for handover to all the patients being shared in that handover. And then the front page is my patient load, so that if I have to cover a nurse who's going on a break, I would just flip the page and then, that's my reference. Flow sheet, safety first, and I made a list here actually of reasons why you as a nurse would get anxious before work. And okay, here is number 1. You don't know what to do, or there's so much you still don't know. How I would address this is, it's okay not to know as long as you know what you don't know. Don't try to impress anybody. Remember, what's our priority? Patient safety, not patient satisfaction. What's our priority? Patient safety, not people pleasing. All right? Because if you're going to try to impress someone by pretending that you're okay about doing something and you make a mistake, remember, you are a professional. You have a license to lose. And if you lose that license, it's like you threw away your years in college. All right? And the money you spent, or your parents spent, for your education. So it's okay not to know. Do your best to learn. Okay, like for example, if you don't know how to do catheterization, urine catheterization, ask for help. Always know the chain of command or the chain of communication. Who do you as a nurse, if you don't know anything, if you don't know something, who is next in line for you to contact? Is it the charge nurse? Is it the doctor? Is it the unit coordinator? Is it the hospital manager? You have to know who to refer to, okay? As a principle of patient safety, the least you should know are basic vital signs. Basic vital signs ranges and who to refer to. Okay, if it's for the patient's health condition, not if they're becoming poorly, who do you call? Is it the resident? Is it their attending physician? Or do you have to go through a charge nurse before you can speak to the doctors? It's very important. Okay, so very simple. Vital signs, chain of command, chain of communication. Second reason why most nurses feel anxious for me is, you feel alone. You feel like you're entirely responsible for everybody under your care. That is not true. Okay? Yes, you are responsible for your actions as a professional. But with regard to the full scope of safety and care of the patients, it is the facility, it is the hospital, it is the systems in place that are number one responsible to ensure safety, okay, and to protect the patients. Of course, you've got doctors too. The doctors are there to diagnose. The doctors are there to triage the patient, to determine how often they should be assessed, reviewed, etc. That's their job. All right. Now I get it that in the Philippines we're very doctor dependent. Here in the States and in the UK, we're very nurse dependent. But I want to encourage you that the doctors still have a job to determine the acuity of the patient, meaning the level of care that they need. Because I remember when I did my first clinical rotation, I was really scared. I was I was really scared that if I left my patient's room, something might happen to them. Like at all times, I would keep visiting them again and again and again. And then I think one of them got annoyed at me because they couldn't sleep. So I realized, you know what? I'm gonna give them some space. They need their rest. And eventually, I learned that if they were brought into a regular room, it means they don't need intensive care treatment. Okay, that's my appreciation for my experience. And then number three is, yeah, you don't like to be humiliated, and you're going to people please. It's one of the reasons why we get nervous and anxious, because we're like, oh my god, what if they say I'm dumb? What if they make fun of me? What if they think I'm like I'm a fake? And we all go through that. We all go through imposter syndrome. And what I would encourage you is to give yourself grace, give yourself time. Okay, you passed the NCLEX, and that's not an easy thing to do. You have common sense. All you need is presence of mind, a baseline knowledge of your vital signs ranges, who to contact for when you have abnormal values, or if a patient is declining or getting sick. All right, start there. And we're gonna this video is getting long, but I'm gonna make more videos about this. One second. So yep, so remember, just to recap and to finish this video for this segment, patient safety is your number one priority, not patient satisfaction. Okay, patient satisfaction, the main responsibility for that is the hospital and the systems in place. Patient safety means you are giving the medication to the right person, okay, the right time, etc., etc. We'll get to the nitty-gritty details in other videos, but for now we'll start here. Patient safety, your flow chart, and really making sure that you don't people please. All right, so if you have any questions about nursing, or building the confidence, please write in the comments below, and I'll get back to you as soon as possible. But I'm very excited to share this journey with you, and to share my more than 10 years of experience working as a nurse. So my name is Daniel. Thank you for joining me, and if you're new here, please like and subscribe, and I promise you, you won't regret it.